which was about the ECG or the electrocardiogram. So the ECG, sometimes called the EKG, is an electrical activity recording of the heart. We basically place electrodes on the skin. They're placed on the limbs as well as the chest area. And we pick up the electrical activity of the heart and some of the directions, which we call leads of that electrical activity. And we can measure that through the skin. It's a very non-invasive technique. It takes all of a couple minutes, 5 or 10 minutes or so. And we can get that very valuable information about the heart rate and the heart rhythm. It's used typically as a means of ruling out heart abnormalities. So if someone presents to your emergency room, usually in the emergency room, or sometimes routine in our doctor's office, physician's office, we use that to rule out any type of abnormalities with the heart rate. If it's going too fast, too slow, if there are any abnormalities with how the atria are depolarizing or how the ventricles are depolarizing. And so it's one of the first things that a physician will ask for if someone even presents with chest pain, arm pain, jaw pain, difficulty breathing, even gastrointestinal upset, or any type of chest discomfort, because any issues with the heart is usually lethal or quickly can become lethal. And so we want to rule those things out and then look at some of the other causes for some of those symptoms. So we usually ask for an ECG or an EKG immediately when someone presents with any type of those symptoms. As I mentioned before, it's an external measure, so the electrical activity is being, reflected onto the skin, and we can pick up that electrical activity. It's going to give us the way and the distance and the amplitude of how that electrical activity spreads throughout the heart, and we can tell the size of the potentials, and we can tell the synchronicity of the potentials based upon the distance and the amplitude of those electrical impulses. Now, the heart electrical activity should be completely synchronized in that we see this entire complex, which I'll talk about the different factors in this complex, but they should never be separate from each other. So what's happening in the atria is synchronized in terms of happening before what's happening in the ventricles. And so we see the different components of the ECG reading that reflects that. So let's look at those different components here. So the electrical activity of the heart can be measured on the right here. I'm going to kind of compare what I'm mentioning on the left to this image here that shows a sinus electrocardiogram, meaning that it's completely normal. And we can also see the change in the membrane potential reflected above as well. So how the depolarization is happening and how repolarization is happening, which is really the events of a contractile cell that we talked about last time. And if this curve should look familiar to you based on that. So we start with the P wave, and the P wave is the initial depolarizing, which is happening in the atria. We talked about this, right? It starts up in the atria. And so the P wave is a small curve reflecting the depolarization of both atria. We then have the QRS complex. And it's really the bottom of this spike, the top of this spike, and then the other depression of this spike, which is the Q, the R, and the S component of this complex. And that represents two things happening here at the same time. We've got the depolarization of the ventricles at this point. Now the electrical activity has spread down to the base of the heart and the ventricles start depolarizing. But at that same time, we also see that the atria have begun repolarizing. So the QRS complex represents not only the depolarization of the ventricles, but the repolarization of the atria on top. The next slight curve that's a part of this entire complex is called the T wave. And the T wave represents the time now where the ventricles have begun repolarizing. And so this is the end of the entire sinus electrocardiogram reading. So we've got the P wave, the QRS complex, and the T wave. And so it's the atria depolarizing or contracting, then the ventricles depolarize while the atria repolarize, and then finally the ventricles themselves repolarize. Now, there are also other segments or relationships that we can look at in terms of the different components of the reading here. We can look at the PQ segment, which is really that brief period in between the P wave and the start of the QRS complex. And that's called the PQ segment. And if you look really closely, you'll see this straight line in between those two areas of the curve, and that is basically representing that small delay between the time that the atria repolarize and, depolarize, and the time that the ventricles depolarize. So the PQ segment is just representing the AV nodal delay, that slight, pause to allow the atria to fully contract before this electrical activity is conducted down and the ventricles can start depolarizing. We can also talk about the QT interval, which represents ventricular systole. So the entire part of the curve from the QRS complex to the end of the T wave represents the squeezing of the ventricles. We're going to talk about what systole means as we talk about the phases of the cardiac cycle next, but systole is when the ventricles are squeezing, they're ejecting blood, and so they're depolarizing or contracting, and that's all of the events between the Q of the QRS complex and the end of the T wave here. And then we can look at the ventricular diastole, which is basically when the ventricles are relaxing and receiving blood or filling. And so that's going to be the TQ segment, basically the end of this entire curve. So the end of one complex and the beginning of another. So the time it takes from the T wave of one complex all the way to the Q segment of another complex is the entire time that the ventricles are filling. And what we will come to see as we look at the phases of the cardiac cycle is that ventricular diastole is longer, much longer than ventricular systole, because the ventricles need more time to fill than they do to empty. Okay. Now, as far as this goes, I don't want you to focus too much on the amplitude or the duration of these waves. I also don't want you to think about any abnormalities. So there can be lots of abnormalities that, clinicians look at to determine, if there's tachycardia, this curve is really, really small. If there's bradycardia, which is a slow heart rate, this curve is really, really long, or really, really wide, I should say. And other types of changes with the QRS complex can determine other, abnormalities with the ventricles and so on. But what I really want you to focus on is the normal QRS, the normal electrocardiogram reading and what those parts of the reading mean. So what does the P wave stand for? What does the T wave stand for, et cetera, and not so much how we do the EKG or any type of abnormalities with the reading. Okay. All right, and I've also posted this video on Brightspace, so you can refer to this video to give a bit more clarity on this. Okay, so that's the end of packet packet 2. We're going to start a few practice questions here before we move on to the cardiac cycle. So I'm going to launch this poll. All right, last couple seconds. All right, so a lot of response for B. Which two types of autorhythmic cells coordinate and provide rhythm to the heartbeat? So a lot of response for B, which is the pacemaker cells and conduction fibers. So that is correct. None of the other cells make sense. So transmission cells is not a thing, neither is timekeeper cells or recruitment cells. So the only viable option is the pacemaker cells and the conduction fibers. And remember, we talked about these specific groups of cells having that pacemaker potential, being able to spontaneously depolarize and then passing that electrical activity on to other cells, such as the contractile cells. Okay, let's look at another. Okay, last 10 seconds. All right. All right, so a lot of response for A. Oops, okay, so what are the two concentrations of pacemaker cells in the myocardium called? So A is atrioventricular and semilunar nodes, so this is not correct. Okay, a lot of you selected this option. Semilunar nodes is not a thing, okay? And this tells me that a few of you have not looked at this information properly. So semilunars are the valves, okay? The nodes or the cluster of autorhythmic cells are the sinoatrial nodes, and then the atrioventricular nodes, okay? So make sure that you go back and review that and try to keep this, these two ideas separate. The valves, the semilunar valves include the aortic and pulmonary valves. Those are the valves between the ventricle on either side and the artery on either side. And then the AV valves are the bicuspid and tricuspid valves, and those are between the atria and the ventricle. So make sure you go back and review the valves and make sure that you're keeping them distinct from the cluster of pacemaker cells or the nodes. And this is going to be option B for the correct answer, atrioventricular and sinoatrial. Let's look at another question. All right, let's see. All right, so a lot of response for A. And the question is, what is the order of channel openings for the action potential of an autorhythmic cell? And so autorhythmic here means a pacemaker cell. So although that's not written, that's what you should be picking up. And so we start out with the opening of funny channels, which we talked about, right? So funny channels open first, and that kind of quickly eliminates the other three options. So funny channels open up first, then our T-type calcium channels, sometimes called slow calcium channels. I didn't point that out, but I want you to make a note of that now. T-type channels are sometimes called slow channels. And then L-type channels are what we sometimes call fast channels, right? T meaning transient, L meaning, I forget, but T-type sometimes slow, L-type sometimes fast. And so we've got the funny channels, T-type calcium channels, L-type calcium channels, and then the potassium channels that completely repolarize. Alrighty. So the option here, the correct option would have been A. And make sure you know this exact same information for the contractile cell, because I could have easily put in this question stem, what is the order of opening of channels for the action potential of a non-autorhythmic cell, right? And that would have meant a contractile cell, which would have started obviously with sodium, then, you know, closing of sodium, then our calcium channels. Alrighty. Okay, we've got one more question and we're gonna move on. Let's relaunch this. Last couple of seconds. All right. All right, so overwhelming response for C. What is the electrical pathway of the heart in order? So we start out with the SA node, and so we can quickly eliminate B and D. And so we look at A first. So SA node, internodal pathways, AV node, Purkinje fibers. So we know that the Purkinje fibers are the final conductive fibers to receive the electrical signal, and they do not receive the signal before the bundle of hairs or the bundle of branches. So that also eliminates A. Let's look at C, the SA node, the internodal pathways, the AV node, then the bundle of hairs, then the bundle branches. Remember, here's where it splits off into right bundle branches, left bundle branches, and then the final fibers are the Purkinje fibers. So the correct option here would be C. Okay. All right. Oh, we've got one more question here. Oh, there's quite a few. So let's do one more question. But I think these are really helpful questions in terms of the most important aspects of what we've talked about so far. So let's relaunch this and look at one more question. All right, last couple of seconds. Okay, let's see. So what happens during the QRS complex? A lot of persons selected C, ventricular depolarization and atrial repolarization, and that is correct, okay? So we said here, the ventricles now receive the electrical impulse, they start depolarizing. At the very same time, the atria are relaxing or repolarizing. All right, so the correct answer is C. Okay,